Everyone. We are recording the presentation. This is our second EVV public forum of this year related to implementation of our electronic visits verification system. I'm Brian Dowd. I am the Deputy Executive Director over Policy and Compliance at the Department of Community Health, and most of y'all probably know me in one way or the other. And I'm very, very thankful that you have decided to join us here on this Wednesday night at 6 o'clock. That makes me happy that you are so invested. You will not, here's the good news for today. You will not hear a lot from me today. That's the good news. I think you're probably tired of hearing from me. I'm tired of talking. I'm just going to go over some basic communication stuff, and then we're going to turn it over to Joe Schnurr, who's going to walk us through the actual Tellus app. Joe, do you mind advancing to the next screen for me? We always start all of our presentations at the Department of Community Health with the mission, which is to provide Georgians with access to affordable quality health care through effective planning, purchase, and oversight. Next slide, please. So today I'm just going to refresh your DCH communication resources so you can stay completely up to date. Joe's going to give you a pretty great introduction to the Tellus app, the mobile application, and then we'll take some question and answers. Next slide. So before I say that, I do want to say a couple of things about the question and answer period. Try your best not to put in PHI in your question to your specific issue. We will respond to all questions. If we don't have time tonight to respond to all questions, we will compile the questions and we will put them as part of a Q&A. But we try and keep it a high level. I'm just very sensitive to PHI and getting folks information. And sometimes you think you're not giving PHI, but people can figure out who you are from what you put down. So just be careful about what you put down in your question box. Try and keep it a general question. So communication tools. First of all, please, 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 please visit our website. Everything, and I do mean everything, is on the DCH Georgia EVV website, and the site is right there. If you don't have time to copy that down or you haven't been to the website before, put in your Google or whatever search engine you use, DCH GA EVV, and I promise you that'll be the first thing that comes up. And you can click on it and you'll be on our website. Our website has all kinds of stuff on it. It has member-specific information and member advocacy group information. It has specific provider information. It has third-party information, which includes the specs for if you have a third-party EVV system to connect to the Tellus EVV system. Also, we have a dedicated EVV email box that was completely caught up as of yesterday, and that is evv.medicaid@dch.ga.gov. You can write that email box and we will respond to each and every question that comes into the mailbox. You can also request via that mailbox some updated, some time to talk to us one-on-one if you want to. So far, I've gotten one of those requests for February, but I've only gotten one request. Also, on that website, we have all of our PowerPoint presentations and recordings. So you can go back to listen to this presentation, the presentation we had yesterday, or any of the 3 presentations we did last month. They are all there with the slide decks and the recordings. We have flyers and announcement. We've done member and provider readiness surveys. We have frequently asked questions and quick reference guides. All those are available on our website. Okay, as promised, that's all you're going to hear from me today. I'm now going to turn it over to Joe Schnurr, who is the, I keep making up your title, Joe, but I'm now going to call you the Customer Service Director at Tellus.
All right, thanks, Brian. And good evening, everybody. It's great to be with you tonight. So my official title is actually the Chief Customer Officer. I've been with Tellus now for 3 years. and I've implemented EVV in multiple states and different programs. And I've been fortunate to work with many providers like yourselves. And so I'm looking forward to giving you an overview of how the mobile application works within Tellus. So let's go ahead and get started. So I know we've showed this slide before, but I thought it was important that we share it again in case you hadn't seen it. So first of all, the mobile application works on a smart device, whether it's a phone or a tablet, just as any other mobile app would work, such as Facebook or a banking app or any other app that you can download. The technology specifications for your device and the software on the device is documented, and it's available on the DCH EVV website. Like Brian promised, all the information is on the website, including the specifications of the devices. So if you say, oh, my phone is 3 years old, is it going to work? So go look at the specifications, and you'll figure out the answer from there. You download the app from the Google Play or the Apple Store. You would go to the Apple Store, you would search for Tellus EVV, and you'll see the mobile app. And I'll show you it on my phone just so you can see what the app looks like. One question we often get is, well, what happens if I'm in an area without any cell or Wi-Fi coverage? How is the app going to work? So the app works in what we call offline mode that allows a visit to still be completed when there's no internet available. So we call that the phone is in an offline mode. So as long as the visit has already been created, you can start and complete a visit without internet coverage. So wanted to make sure everybody was aware of that. The second question that we often get is the app tracking me? So the app is not tracking anybody. The way it works is that when you hit the start visit and complete visit, the app uses GPS to take a snapshot of the location when you hit those buttons. So at no other time are we using GPS to identify location, just when you actually hit the start and you hit the complete button. So I wanted to make sure that we were grounded on the basics. So this is a slide that shows a progression of how the app works, and it starts from the left side of the screen to the right side of the screen. And again, I'm going to walk you through a demo, but I like to show this because it helps you to visualize kind of start to finish, from seeing my visit on my calendar, to checking in and hitting the start button, to checking off any tasks that I may have. As you can see in this example, there are 2, cleaning and cooking. So I have the ability to check off those tasks. Then at checkout, I get signatures from both the recipient and the caregiver to confirm that these services have been delivered. And then I hit the complete visit and I get a thumbs up that, or a notification, as you can see on the screen there, that the visit has been completed and successfully verified. So pretty easy to use. So hopefully, again, this gives you kind of a quick overview, and then you'll see more in the demo. There are several advantages to using a mobile application over paper. I'm sure many of you are documenting visits on paper today. So I thought it was important that we go over a few of these. So the first one is, with a mobile app, the visit can be started and ended at any location. And there are times when I'm sure that you're going to start a visit maybe at a doctor's office or even a park. And you may end the visit at a different location. So the mobile app allows you that flexibility to be able to provide services in the community. You saw on the previous screen how we can capture signatures. I'll show you an option how you can, if the recipient's not available, that a family member or a guardian can also sign. Schedules can be downloaded onto the app automatically when they're created centrally by like an agency or a fiscal agent. The schedules can also be created on the mobile app by the caregiver if the agency or the fiscal agent allows that feature. Services and tasks can be performed and they're visible. We'll show you that. The next option is a nice option to have. So this allows secure messaging between the caregiver and the agency through the application. So this is different than texting because texting is not HIPAA secure, but our app does have a secure messaging feature. There's also a visit timer, so it reminds you how long you've been in the visit in case you lose track of time. There's ability to enter notes and even alert an administrator. You can go back and look at previous visits to if you need to remember when did you start and end the visit and what task did you provide. There is the ability to add documents such as a DNR. The recipient's phone number and emergency contact information would be available in case you ever needed that. And then lastly is you can use Google Maps to get directions to the visit location. So it will automatically send the visit location, the address over to Google Maps if you wanted to, so that you can use the Google Maps to identify the directions. Okay, so Brian, if you'll give me a minute, I'm going to switch over to my phone and then I'll start the demonstration.
Thanks. And I'm going to take this opportunity to answer a question that we've had before that I've already seen as two of our questions from tonight, which is two different questions. What happens if a participant can't sign at the end of a shift? And then the caveat to that is also assume that a recipient or family member or guardian can't sign at the end of the shift either. And I've gotten this question several times in the email box as well. The scenario that is most frequently given is that there is an aide in the house and the family member or guardian can't be there to sign either. And it's basically going from aide to aide. And there would be no capacity for the member is just physically or for whatever reason cannot sign. We will have an accommodation for that. The member is not going to get service because they can't sign. That's not something we're going to do. But we will be, with all things with EVV, we're trying to conform to the federal requirements. And we're also trying to remove as much as possible documentation and extra work that has to be done on paper that we can capture via the electronic method. So I want to assure everybody you're not going to somehow get kicked out of community living services or personal support services because of that situation. The other question, I think I need to wait for you, so I'm not going to try and go there.
Okay. Are you able to see my mobile app?
I can, so your app is still working. It's good news.
Yes, I was able to get it to work. So what you're looking at is actually my cell phone reflected onto the screen. So you can disregard my other mobile apps there, but you can see at the top center, Tellus EVV app, and it has a little green circle symbol there. So I'm going to go ahead and start the app by clicking on the app. It's going to ask me for my passcode. My phone allows me to use my thumbprint, so I can use my thumbprint. So if your device has the ability to use thumbprints or facial recognition, you can use that as your PIN to help you quickly sign in. And when you first sign in, you come to the home screen, which you're seeing here, which is basically a calendar. And we actually modeled it after a Google Calendar because lots of people use Google. And these are the visits that have been created in the Tellus system. Again, we mentioned that the visits can be either created centrally by the administrator in the Tellus system, or there is a feature to allow you to create a visit on the mobile app, which I will show you. You can see that I had a visit earlier today at 2 o'clock, which I completed, but I was late for that visit. And then you can see that I have a visit that was supposed to start at 6, but I've not started the visit yet. So I'm going to go ahead and start that visit by just clicking on the visit, and then it's going to load the visit. Now it's saying that I haven't signed in a while, so I haven't entered my password in a while. So this is for security reasons. Okay, so now I'm going to load the visit. So the first screen that it brings me to is a very simple screen. It just shows me the scheduled start and end time, the address, and you can see next to the address that little symbol. That's the symbol that will kick me over to Google Maps if I wanted to use directions to get me to this location. You can see my visit is with Jill Tyler there at the top. Gives me the date, and then it gives me two options. I either can start the visit, or if there's a reason I cannot start the visit, I hit that second button. So I'm going to hit that just to show you. And what it's going to do is it's going to bring up a list of reasons why I could not start the visit. So maybe the recipient was hospitalized and I wasn't aware and I found out when I got there. Or maybe I made a scheduling error. So these are all the different reasons that you can use or you could not complete the visit. So I'm going to go ahead and cancel this because we are going to complete the visit. And to start it, you just simply hit the Start Visit button. Now it's giving me a notice and it's saying, warning, you are not at the scheduled location, which is true. I'm actually located in Florida giving this demo today. And when I hit the Start Visit button, my device it used the GPS to identify my location. And it realized that I'm not at 215 Peachtree in Atlanta. I'm actually in Florida. So it's giving me a warning, but it's not stopping me. I can still go ahead and create the visit, but it will flag this visit on the back end to make sure that if there was a legitimate reason for not being at the location, that I enter in a reason code to tell the system what was that reason. So I'm going to hit OK. And it's going to load the visit. And now you can see that the timer is started. So that's the timer that I had referenced. This timer will continue to go while you're in the visit. So that way, if you lose track of time, so like, for example, here, this visit is scheduled for a 1-hour visit, but I started the visit at 6:20. I didn't start it exactly at 6. So I may forget how long I've been in the visit, but I know the visit's only supposed to go for an hour. So I can quickly look at my app to understand how long I've been here. As I page down on the app, I can see that I'm scheduled for unskilled respite care. And I have 5 different tasks that I am to complete. You can see feeding assistance, meal prep, bathing, dress and undress, and the laundry. So this is what I'm supposed to be doing for my hour-long visit. And at this point, I'm done using the app until I'm done with my visit. So really with 2 quick buttons, you are in and started the visit, and you can put the phone down, you can turn the app off. You don't have to touch your phone at all anymore. And that was one of our key requirements, is that we really didn't want the caregiver to be spending lots of time in the app, because their job is to be providing the services. One other thing I will note is at the top left, you will see something that says note. So I'm going to go ahead and hit that. And what it does is it opens up a screen for me to enter a note. And you can see actually some previous notes that I had entered. I can also, you see the little box down the bottom, it says alert my administrator. If I want to alert my administrator of the note that I'm going to enter, I go ahead and hit that little box. So let's go ahead and enter a note. And let's say that, we'll just do a simple one, that Jill is feeling well today. She's having a good day. And I may not want to alert my administrator of that. I just may want to keep that in my notes so that I remember. But if I did want to alert my administrator, maybe Jill wasn't feeling well in my earlier visit, and I want to alert my administrator that now Jill is feeling well. So I can go ahead and hit that button. And you can see that it put a little check box, and then I hit that green up arrow, and that sends the message. So again, it's very much like texting, but it's in a secure way. And now you can see that note was entered. And when my administrator logs into the Tellus portal, they're going to see my note on their inbox. So that's how the note feature works. So now I'm back to the visit. And we've been in the visit now for 3.5 minutes. And for the purposes of this demo, we're going to go ahead and end the visit now. So I'm going to hit the end visit button. It does ask me, are you sure that you want to end the visit? Just in case I hit the button by mistake. I'm going to go ahead and hit yes, I'm sure. Okay, so now it's going to ask me to confirm that I performed these tasks. So these were the tasks that we saw in the beginning. And let's say that I didn't do the laundry. Maybe the laundry, there was no laundry to do. So, or they didn't want me to do it during this visit. So I can uncheck the laundry. But everything else I was able to do. And then I can go ahead and hit complete the checkout. And now it's bringing me to the signature screen. So what you'll see up at the top is that it's confirming the services and the tasks that were completed, and in the case of the laundry, was not completed. So you can see all that listed there. And then what it's saying is that the people that are going to sign below are confirming that these services were rendered on Wednesday, December 9th from 6:20 to 6:24. So now it's time to capture the signatures, and you can see that it's asking for the signature of the recipient and the caregiver, which is probably the most frequent case, but there may be examples where maybe the recipient is not available for many different reasons. So we can go ahead and hit the recipient box there. That's sort of like mustard colored box that says recipient. So if I click on that, it brings up a little screen and gives me some other options. So maybe I can't capture a signature in this visit. That might happen. Or maybe the legal guardian or representative is available. So I'm going to go ahead and select the legal guardian. And I'm going to hit OK. And now you can see that little box that changed the legal guardian, because now the legal guardian is going to sign. So I'm going to go ahead and hit the little pencil there. And maybe Jill's legal guardian is Bob Tyler. And that's Bob Tyler's signature. So we can hit complete. And then the caregiver is myself. So I'm going to hit the pencil and caregiver. And that's my signature also. So I'm going to sign off. And so now I've captured the signature. So we just went through a visit. Hopefully you found it pretty easy to use. Again, it's meant to be a progressive screen so that you don't get lost in the app. And then at this point, all we do is hit complete visit down there at the bottom. And now it's going to verify this visit. And then it's going to give me the signal that the visit has been completed and successfully verified. And then you can see that it's reflected on my calendar there as being a completed visit. Okay, so let's show you a few other things. Let's show you how to create a visit from the mobile app. And again, this is a feature that an agency and or a fiscal agent can decide to toggle on or off. So if they turn it off, then this feature would not be available to the caregiver. But if it is, I can hit, you can see down the bottom, there's three kind of symbols. One says home, that's the screen we're on now. One says messages, we'll get to that next. And then that little one, there's a little icon, that's for your recipients. So if I select that, these are the recipients that me as a caregiver are tied to, or what we call linked to. So the caregiver can only see the recipients that they're entitled to do visits with. So for me, it's only Jill. So if I go ahead and select Jill, it gives me a few options. It gives me some addresses that could be used for Jill. It gives me some phone numbers, and I can hit the little phone thing and call up, so automatically dial to that number. There's no emergency contacts that have been loaded in the system, but if there were, those would be listed here. There's also no documents loaded, but if those would be listed there as well. And then you can see scheduled visits. So if I select scheduled visits, it will pull up, these are all the visits that I've completed for Jill. So you can see yesterday I had a couple visits, 3 of which I completed and 1 actually I missed. And then I had 2 visits today. 1 we just went through and 1 I completed earlier. If we click on that visit, it will give me the details. So you can see this is the visit that we just completed in the demo. So I can go back and see my history on my visits. So if I hit the back arrow, it gets me back to this screen. And then the one last button I'll show you on here is it says add new visit down the bottom. So I'm going to go ahead and click that button. And now it brings me to a section where I can go ahead and create a new visit. So first it asks me for the address. So I select that and it gives me the drop down. So I select the Peachtree location. Same with the ending address because it could be different. Then I got to select the payer. And if there's only one payer, then it will automatically load that one payer. If there are more, let's say Jill had, she paid private pay sometimes, then it would give me an option for private pay as well. And I would have to select which one I'm using. Then I select the start date. So let's say I'm going to do a visit later on this evening. So, and then the end date. And again, if you need to change any of these, you just use this toggle to move the dates around. I hit OK. Same with the start time and end time. So I'm going to hit that and I get the same type of wheel. So let's say I'm going to do this next visit at 8 o'clock tonight. So it's pretty easy to change. I hit OK. And let's say it's going to be an hour-and-a-half long visit to 9:30. So I hit OK. Now, the last thing I need to do is select which service I'm going to provide. And you can see the list of services. These will be the services that are approved for the payer that I selected. So I'm going to go ahead and select the unskilled respite. And again, those same options that were there before, these are the tasks that have been previously loaded into the system by the administrator for this specific service code. So let's say that I didn't do the laundry earlier today, but I did the bathing already, so we're not going to do another bath. And maybe we're still going to do the other things. So we will leave those checked, but we'll uncheck the bathing. So now I'm completed. I've got everything set up. I know where I'm going to do it. I know when I'm going to do it. And I know what services and tasks I'm going to provide. So I just hit the submit button. And now it's going to load this visit into the system. And you see I got the sign that it added it successfully. And then when I go back to the home screen, down the bottom there, I hit home, you're going to see that visit is now on my calendar from 8 to 9:30. And when that time comes, I can go ahead and start that visit and complete it just like we previously went through. So hopefully you found that, again, pretty easy to schedule a visit on the fly using the mobile app. I'm going to select the messages down the bottom on the right. And again, these are the messages that I've entered into the system. All right, the last thing I'm going to show you is in the upper right, or I'm sorry, the upper left, there's a little menu button. It's sort of three dashes. If I select that, it gives me a couple options. It allows me to change my password. I can actually get support through the support number. Manage accounts. So if a caregiver works for several agencies and all the agencies are using Tellus, then the system does allow the caregiver to have one login and be able to manage through one login. So they don't have to have multiple logins for every agency that they work for. And on their calendar, it will actually show visits from multiple different agencies. So if I have a visit for one agency in the morning and a different agency in the afternoon, both will show on my calendar. You also you can update your profile on here. You can also switch the language. So if I select that, you can see it as English and Spanish. So I can easily click Spanish and change over everything into Spanish. And then I have the logout feature. Logout is critical for if you are going to share a device between caregivers, then the caregiver must log out of the application in order for the other caregiver to log into the application. So that's a critical feature that if there's examples where two caregivers are going to be sharing one device, they just got to make sure that they log out. So hopefully, again, that gave you a quick overview of the Tellus application. Of course, there will be plenty of training in future sessions, but this was meant to really give you a sneak peek of the mobile application. So let me go ahead and stop sharing this screen. And then I have one last slide. Okay. One last slide here. So as far as the mobile app, there are really no immediate steps that you all have to take. In fact, I would recommend that you do not download the app at all, just because we're doing updates to the app to always improve it. And I'd rather you download the app as we get closer to registration and when you're actually going to start using the app. So you don't need to do that. I would ask you to hold off on doing that, and you will be notified when the time is correct. And attend town halls for mobile app registration, which will take place approximately 30 days prior to the registration opening. We'll have lots of different communication, and I'm sure even a very specific town hall to walk everybody through what that process is like and how you get registered for the system. So I think at this point, Brian, I will turn things back over to you.
Okay, great. Thanks, Joe. That was a really great overview of the system, and I really appreciate it. So we have some questions in both the Q&A and the chat sites, and I hope to get through as many of them as we can, Joe and I. I can see them both. So Lee Clovis, I'll be able to do this, so you don't need to. And I do want to tell people one other thing. I again want to encourage you to visit the webpage, our DCH webpage, and to utilize that email box that I gave you earlier. That can be a one-on-one question. You can have it in written guidance for you ongoing if you use that mailbox to answer your question as well. Okay, let's start at the top. So the first question we received is, can it, and this is a kind of, there's two questions that kind of are related here. It's, can the system, you talked about if there's not Wi-Fi available. The question is, can it create a GPS snapshot if offline when the Wi-Fi is not available? And then the different follow-up question to that is, what is meant when you say, as long as the event has been created?
Okay. So the first question is, if I'm in offline mode and there's no internet, how does it able to collect the GPS snapshot? Good question. So all mobile devices or smart devices these days, they have what they call a GPS receiver in them. And the system is still able to capture a GPS location, even though there's no internet. So it is still able to do that, even though there's no internet. So that will still work. And then what I meant by as long as the event is created. So in order to create a visit on the device, it does need internet connection, because as you're creating it, is actually bouncing up against the server to get the correct information. Like when I'm selecting the addresses and who the payer is, it's actually syncing up with the server to pull that information over. So you do need internet connection in order to create a visit. So if you know you're going to be in an area, you know the visit's going to be in an area where you don't have any connection, even Wi-Fi, then you're going to need to make sure you create the visit in an area where you do have internet connection. And then as long as that visit is on your calendar, you'll be good to go to create it or complete the visit in the offline mode.
Thanks, Joe. That's a great explanation, and I really appreciate both of them. The next question that we haven't gone over was just answered by Joe, which is yes, you can still sign in an offline mode. The next question we have is, when is a caregiver provider considered late for a visit? I'm getting a lot of this question lately about, well, you know, what do I do when my caregiver is late? And you guys probably know this, and these are great questions we're getting. But I'm also the audit guy for the state. So we don't pay for somebody in services when they're late. We pay for when the service begins to when the service ends. I've gotten, and that might not be what this person was asking. But so for us, there's really not a late visit. You're not late as much as we will look at your lateness versus the schedule, just because that's just a nice tracking message for you. But that provider should check in when they get there and check out when they leave. There's another great question about what happens if you lose a password, and I can assure you there is a whole training module associating with resetting lost and forgotten passwords. And I have already reviewed it, and it is very, very good. And that will be a part of a future training. And don't worry, I lose and forget my passwords all the time for everything. I'm the worst about it. Does it track and record each time a user tries to start when not at a scheduled location? Yes, it does. So as Joe said, the system tracks when you log in and when you log out and not in between. That's what it does. So even, you might not be at a scheduled location, and we understand that. We understand that typically most locations will start in the member's home. But I've been presented from people that, hey, every single visit for my mom or my son starts at their adult day health center or their community access group center. So that is something that is completely allowable by the system. Is the incomplete task list the only service documentation? Would goal, outcome data, and or additional narrative not be required as currently is for some services? So what we're trying to do, and that's an absolute positively excellent question. So what we're trying to do with this is trying to make the documentation as much as possible. You saw that the app had a note screen. So what we're going to do here over the next couple of months before we get to the pilot state, which is April 1st, is look at what the EVV system has and see if we can't simplify the documentation to the point that hopefully it will be what is required for the CLS or PSS visit. How does it work if you're providing two-person CLS? So that's one of the things we're going over with Tellus right now. If it's just a matter of two people having to sign in at the same time, we recognize that there are some limited cases where this occurs in the comp and now waivers. So we are aware of that concern, and it is a good question. The next question is, does everyone involved in the visit only sign at the end? So we look for a signature from the caregiver, always, and then a signature from the member and or the member's family member in that list of folks that Joe went over. And there, as you saw from that, which was really great, and I really appreciate Joe showing us that there is also this option for no signature collected at this time. So we'll have further guidance on when you use that. Does everyone, oh, that's what I just did, sorry. So this is one I may need your help with, Joe. If a caregiver works for two or more providers that use Tellus, so Brian's agency and then your Joe's agency, will the mobile app of the care visitor's phone be able to identify which provider they are for completing a visit, and will the caregiver need to have multiple usernames and passwords?
Yeah, so the system will allow the caregiver to have one username and password. And then as the visits are being created, the recipient that you select is tied to the agency. And that's how we tie back that visit to the agency. So again, in my example, if I'm a caregiver and I work for two different agencies, I could have a visit in the morning for one agency and a visit in the afternoon for another agency.
Thanks. Is it possible to adjust the visit time in and out? Like, let's say a caregiver forgets to sign in or loses their charge on a smartphone. Yes, there will be the administrative component to correct errors. That is function, not as part of the app. That'll be a later for the administrative dashboard to go over. So tasks are assigned to service codes, not the individual. Well, there should be a book of common tasks that are associated with service codes, right? So I want to remind folks that this service is for community living services and personal support services, whether that be in the noun comp waiver, where we call it community living services, or personal support services, which we call in the Georgia Pediatric Program, the elderly and disabled waiver, and the ICWP waiver. We have a common understanding of what the services are that should be associated with that personal support service or community living service. And there are multiple codes that kind of can even break out within that code what we expect or what the definition of the service is. So yes, it will be signed to both the individual. I wouldn't say not the individual, because the individual's plan of care delineated those services and the need for those services that then by definition indicates the tasks. So I definitely wouldn't say that it doesn't, but yeah, it is, there are tasks associated with the service. Okay, the next question is, based on this demo, will families that are participant directed in the service, we have the ability to not only bill CLS, but CAI in this app? Many employees bill for both service and one visit. Again, great question, one that we've had on several occasions in different ways. Right now, the state of Georgia is just, we've just bid and contracted for personal support services and community living services. There aren't other services that we have included in our EVV because that was the federal mandate, and we just kept it to the federal mandate. As it relates to participant-directed families, there's a couple of questions here, and I might not be able to get to all of them because we've had a couple more come in since I started answering questions, and that's great. But there's a lot of questions around consumer-directed or participant-directed services. We will have specific breakouts associated with participant direction. We will be meeting with all the fiscal intermediaries to discuss with the fiscal intermediary. So that is something that we plan on doing as part of this, the multiple fiscal intermediaries. Our hope is to not disrupt services to the member as much as possible. And if we can use the fiscal intermediary system as the EVV of record, if it meets state and federal guidelines, and then use the aggregator model for Tellus to speak for the participant protected, the FI model to speak to the EVV model, then it will cause the least amount of disruption for members. That is our hope. I hope that was a really long answer to that question, and I apologize. But again, they're recording these, so if you need to go back and listen to answers, or if you need to follow up with an individual question to the mailbox, please do so we can elaborate on it. I certainly want to answer everybody's questions as much as possible. The next question that I have in is, can you schedule visits for each of your staff and will it show up on their devices? Yes, you can. So there is, as the administrative function, the ability to have them do that. The next question is, the system appears to revolve around the caregiver, not the recipient or representative. Would I not set up requirements and times for my daughter's caregivers? Absolutely you would. There should be a plan of care, and that plan of care should indicate a couple of things. It should indicate the service level for CLS or PSS that is required according to that plan of care, and it should also have a standard schedule. That doesn't mean that you absolutely positively always have to stick to that schedule. We all understand that things could happen where a caregiver may need to stay late one day, or you know what, you don't need a caregiver one day for any number of reasons. You might say, hey, I don't need this caregiver today. So the schedule is flexible, but there should be a standard number of units according to your plan of care, and there should also be an expected schedule. Are there other languages available on the app other than English and Spanish? I think that's all that are available right now on the app, correct, Joe?
That is correct, yes.
The next question is a question about what type of EVV app will be used. I think I answered that with the other question. The next question is another participant directed question that has to do with if oh no, it's not, I'm sorry. But it says a person will receive 2 hours of CLS, 1 hour of CAI, 2 more hours of CLS, another 2 hours of CAG, and then 1 more hour of CLS in a given day. That's an interesting plan of care. So, and it may very well be happening a lot. So that's I can see it happening. So you'll check in when the CLS starts. You'll do the CLS for 2 hours and your checkout. When you go back to do the CLS, you'll check in. And when you quit, you'll check out. And then when you do your final hour, you'll check in and you'll check out. And the system will roll up all those hours for the day and include them as a unit. As long as there's enough in your prior authorization for service to include it, it will be allowed. Will my EVV system be able to integrate with Tellus? Joe, do you want to talk about the integration stuff real quickly?
Certainly. And again, the Georgia team has done a great job on the website, and there is a specific area on the Georgia EVV website that speaks specifically to integrations with other EVV systems. Lots of good information on there. So what you will find on there is, first, there's a specification for the vendors. If your vendor hasn't downloaded that, please ask them to look at that, make sure that they meet all the specifications, and then there's an area for them to sign off on that. That's kind of step one. And then step two is to engage with Tellus to begin the integration, and they do that by sending us an email. And that email is integrations@fortellus.com. Again, that is on the website. And then when they do that, we will schedule a kickoff call. We'll send them some paperwork with the integration guides and all the specifics, and then we'll answer any questions they have. The good news is that Tellus is integrated with more than 80 different EVV vendors already. And many of the vendors that are working in Georgia, we either have existing integrations with or at a minimum relationships with. Not everybody, but a majority of them. So we're in good shape, and we'll look forward to meeting the newer vendors that we haven't worked with yet. Does that help, Brian?
Yes, thanks very much, Joe. That absolutely does help. So I don't think we're going to get to all the Q&A, and there's some in the chat, but I've had a couple of follow-up questions, and I just want to re-emphasize something because I've had a couple of people in the chat and in the questions say, so wait a minute, are you saying this isn't for CAI or some other services? And the answer to that question is that's exactly what I'm saying. This service is just for CLS. And I'm going to take a moment to encourage you to go back to the website again, look at our frequently asked questions, look at the previous presentation. In an appendices to one of the previous presentations, not only do we specifically list every single service that is covered, we go through each waiver and list out all of the services that are not covered. So you are able to see the specific services that are covered and all of the many services that are not covered as part of EVV. So please go back and look at those presentations if you have a moment. There's a lot of great information on there. Okay, I am going to try and utilize our time as much as possible right up to 7 o'clock. So let me get as many more questions here as I can. Any updates on the EVV platforms fiscal agents have chosen? Again, we'll be meeting with the fiscal agents and going through that, and there will be specific webinars associated with participant direct or consumer direct. So everything presented tonight is strictly for the caregiver. Is that correct? I would say that EVV is for the member and the caregiver, and all of the information that we are giving is for the member and the caregiver. It is true that the caregiver is the one who uses the app, but that is at the direction of the member and the sign off of the member or the family member as well. as you've seen from the signature page. So it's really for both. Now, as I've said and just said a minute ago, we will have more targeted consumer-directed meetings. This was an introduction to the app. How does a visit work with supervisory nurse visits and initial assessment visits? So this is only for PSS, associated with PSS. It's not including codes for assessment. So you may need to elaborate on that question a little more in the EVV mailbox. That would be helpful. I do want to note that there is a concern about training with aides with minimal English proficiency, and that will be a challenge. That was noted. So the next question is, does the employee or the employer create the event? That's a really interesting question, and I kind of alluded to that earlier. So in your ISP and your assessment process, you should have a noted plan of care. And that plan of care should have a regularly scheduled schedule for services. And that are really the event creation. If that needs to be modified by the employee saying, hey, by the employer or the member saying, hey, these times don't work for me. Coming at 9 in the morning is really not helpful. I need you to come at 8 or I need you to come at 10. Then that schedule should be updated to create an updated event. If the caregiver provides care at the recipient home and her home as well, how does that work with the app? Well, the app, you can sign in, only captures where you are when you sign in and sign out. If you're providing care at your home or any other location, we would just capture that and it would be noted. How can we download the presentation, and is it being recorded where it can be accessed by folks who did not make this call? Absolutely, positively. It is on the EVV website. So we initially did 3 introductory webinars. All 3 recordings from those introductory webinars were on the website. You can go on and listen to them if you want to, all 3 of them, I guess, but they are on there. So you're welcome to go on and look at those. I guess these are the latest ones, or maybe they're not all on there, but there is a recording. Nope, they're on there. There's number 2, there's number 1. There's series 1 at 11.5, 11.3, and 11.6. So as you can see right here, as we're displaying, there's 3 separate recordings and then the presentation on our website. So there it is. You can go and listen to all of them if you want to, because there are different questions at the end. So I can see maybe that might be helpful, although we are summarizing the questions for Q&A as well. Sorry, that was a long answer. So we are at 7 o'clock. I do want to thank everybody for joining us. Again, we will compile all of the questions we were not able to get to today. I can't tell you how helpful those questions are for our system design, for both me and for Joe and the folks at Tellus and Conduit in the development of EVV. So thank you, everybody, and I hope you have a wonderful night.
Thank you all.
Thanks, Joe. Thanks, Brian.